2014.
We now resume the second reading debate on the Dutiable Commodities Amendment Bill 2014. Professor the Honourable Joseph Lee, Chairman of the Bills Committee on the above bill, will address the Council of the Committee's report. Professor the Honourable Joseph Lee, Chairman. As Chairman of the Bills Committee on Dutiable Commodities Amendment Bill 2014, I present the report of the Bills Committee to the Council and would highlight the work of the Bills Committee here. The bill seeks to amend Part 2 of Schedule 1 to the Dutiable Commodities Ordinance Cap 109 to increase the rates of duty on various types of tobacco by about 11.7%. The Bills Committee has held one meeting with the administration to examine the bill. The Bills Committee generally supports the bill to increase the rates of tobacco duty as a measure to protect public health. During deliberation, members has discussed the justifications for the tobacco duty increase. The Bills Committee has examined whether the proposed increase of the rates of duty on various types of tobacco is effective in reducing tobacco consumption. A member queried the effectiveness of the proposed tobacco duty increase in encouraging smokers to give up smoking, given that the provision of relevant public education and publicity on smoking prevention and cessation is already sufficient and the smoking prevalence in Hong Kong is already low. A member believes a duty increase will only end up affecting the livelihood of newspaper hawkers and the grassroots. Another member, on the other hand, considers that the current tobacco duty increase is small and may not have sufficient deterrence. The administration has explained that the tobacco duty increase is a measure to protect public health rather than raising revenue. It conveys the message that smoking is harmful to health. Relevant research has indicated that a 10% increase in the retail price of cigarettes may lead to a drop of about 4% in tobacco consumption in high-income countries. Apart from tobacco duty increase, the administration has taken a multi-pronged approach over the years in combating smoking. While the current tobacco increase is relatively modest, experience shows that it would be conducive to smoking cessation. Some members have expressed concern about the current state of illicit cigarette activities and are worried that the increase in tobacco duty would make these activities more rampant. The Bills Committee has examined ways to address the problem and made various suggestions to combat the problem, including manpower in the Customs and Excise Department for combating illicit cigarettes, measures for tackling sale of illicit cigarettes through telephone ordering, education and publicity activities, as well as improving intelligence collection. The Bills Committee also takes the opportunity to examine the effectiveness of enforcement of smoking offences in statutory no-smoking areas, including how the Tobacco Control Office can enhance the public's awareness of indoor smoking ban and to enhance the effectiveness of enforcement in different premises. Members have expressed concern about the rising trend in the number of female and juvenile smokers. They have studied information on the measures, including education, publicity work, and relevant collaborations with non-government organizations, which the government has taken in recent years to tackle the increase in the number of female and juvenile workers. Furthermore, the Bills Committee has also discussed the resources from the administration for smoking prevention and cessation services. The Bills Committee is not going to move any CSA to the bill, and it also supports the resumption of the second reading debate on the bill. Thank you.
Ms. Mei-kuen, Ms. Alice Mack, Mr. Tommy Zhang. Mr. President, I've already spoken during the debate on the budget. I find it regrettable to see the increase of the tobacco duty by 11.7%. It is self-deceiving to think that this will reduce the tobacco prevalence. Last time it was increased by 41.5%, and in fact, there was only a small drop in the prevalence of tobacco smoking in the years 2010 to 2012, and a slight decrease of 0.4% from 11.1% to 10.7%. In fact, other than Bhutan, I think we have the lowest smoking population. That is 11%. But please don't think that this is due to the high tobacco duty. This is because the people of Hong Kong are getting more and more health conscious. We have less than 11% of the population smoking. I think most of them are hardcore smokers. I think they know better than the rest of us about the harm done to them by smoking. If they had wanted to quit the habit, they would have already done so without increasing the tobacco duty rate. I don't think it is going to help them quit the habit. I think we are only harming their pocket. We are also harming the interests of the people who are selling cigarettes. We have got 400 newspaper kiosks and 5,000 retailers who stand to suffer from the increase in the rate of tobacco duty. For smokers like me who have the means to smoke, I don't think it will do much to me. But for the grassroots smokers, the same cannot be said. I think they are faced with a lot of financial pressure. $4 more per packet of cigarettes will mean a lot. I've always said that either you have a total ban on smoking or you just leave it as it is. Don't try to stand on high moral ground and try to be unrealistic. And I don't think Dr. Koh smokes. But what about the grassroots smokers who need a cigarette to ease their pressure? By increasing the tobacco duty rate, more smokers will turn to illicit cigarettes. Now, every time when there is an increase in the tobacco duty rate, there will be more illicit cigarettes being smuggled. In the month of February in 2009, the tobacco duty was raised by 50%, and then, in fact, there were many more cases of smuggling of illicit cigarettes. In fact, an increase of 70% compared with the previous year. In the year 2011, the rate was again raised by another 41.5%. 9,100 cases were cracked by the customs and duties in relation to illicit cigarettes, an increase of 44% when compared with the previous year. An Oxford professor told us that as much as 35.9% of the cigarettes smoked in Hong Kong were illicit. So, in fact, we ranked second among the 11 cities in Asia. Yes, the administration has queried the report and has said that this is all due to the effectiveness of our law enforcement action. But then, in the year 2013, we are told that there has already been a decrease in the number of complaints received by the customs and excise. I think this is because they are more watertight in their action, and due to there were 67 million pieces of cigarettes being seized in 2012, and then an increase of 18% as the number went up to 79 million. This is the number of illicit cigarettes seized. Now you know that the criminals would try to make use of telephone calls or internet communication to sell illicit cigarettes. We've only got one task force on the part of the CNE. I don't think they can really deal with such a massive problem. By increasing the rate of tobacco duty, more will be attracted to the sale of illicit cigarettes, including the youngsters. I've already suggested that the government is not trying to increase revenue by raising the tobacco duty rate. I think we should multiply the reward given to informers by 10 times in relation to illicit cigarettes. I think the extra revenue collected should go towards that purpose. We can also spend more money on publicity and public education. Yes, fewer and fewer secondary students are smoking, but then primary school students more of them are smoking. In the year 2010, there were 2 out of 1,000. Now in the year 2012 and 2013, the figure went up to 3 per 1,000. That is an increase of 50%. We have to take preventive measures. We don't want the illicit cigarette sellers approaching the primary students. So we should approach the primary school students early and tell them about the harm done by illicit smoking.
Ms. Alice Mack. President, according to the WHO's report in 2010, about 6 million people died of smoking all over the world every year, and it's expected that should the situation continue by 2013, the world would lose over 5.8 million lives per year due to smoking. Smoking can lead to stroke, coronary heart disease, lung cancer, COPD, and even clogging of pulmonary arteries. Well, smoking is harmful to the smoker himself, and it can also harm other persons by passive smoking. You can suffer from cough, dry eyes, and you may also catch cancer as a result. Or prolonged inhalation of secondary smoking. You may also contract heart disease. In the past few years, the government has increased tobacco tax by 50% in 2009 and 41.5% in 2011. And this time, the proposed increase is 11.2%, or 11.7%. That is 20 cents per stick. The increase is rather mild. Well, in 2011, the duty was increased by 45.5%. There was a marked decrease in the number of smokers, and 11.1% of the smokers were smoking every day. In 2010, it dropped to 10.7%. Many smokers quoted high tobacco prices for smoking cessation or reduction in smoking. According to WHO, tobacco tax should account for about 70% of the retail price of cigarettes. Well, after introducing this round of increase, we will just reach this level. Before the announcement of budget, Koch proposed that tobacco duties should be increased by 100%, a very sharp increase, so as to be an incentive for smokers to quit. However, the final proposal is only 11.7%, so we believe the increase is mild and is supportable. I have to point out that increasing duty alone should not be the only means of the government in tobacco control. While we support a proposed increase because it is relatively modest, but if this is the only means employed by the government to deter smoking, well, you can continue to increase tobacco duty, but the retailers and stakeholders, the livelihood would be at stake. If we look at the total population of smokers, while we have seen a reduction, there has been an increasing trend for some groups. According to Census and Statistics Department, report number 3 of the thematic household survey, in the survey done in between September to November 2012, about 3.1% of the women surveyed habitually smoke every day, and that's a slight increase of 0.1% compared with 2010. As for the number of smokers in the age bracket 39 to 49, there was also a marked increase. And for those who started smoking on a weekly basis, for those who are below 10, the figure also increased mildly from 1.1% to 1.2%. That means that smokers are getting younger. According to the Department of Health, where it commissioned the Hong Kong U to conduct a survey among primary students in between 2012 September and April 2013. For students from pre-4, there was a slight increase in the number of smokers from 0.2% to 0.3%. Before the secretary joined the government, he was involved in this work, and I think he should know that there's been a rising trend in the number of female and juvenile smokers. Now, if we rely on tobacco duty as the only means to deter smoking, obviously, such a measure is not helpful at all in discouraging female and juvenile smoking. So what is the government's purpose? Do you just want to achieve just a general reduction in the number of smokers by increasing tobacco duty to the extent that you're not going to target an individual groups? I hope you can target individual groups, and you must step up enforcement in the sale of illicit cigarettes. Last year, a tobacco company sponsored a survey to survey the sale of illicit cigarettes in 11 places in Asia. It's found that over 39% of the cigarettes consumed in Hong Kong were illicit cigarettes. We took the second place among the 11 cities, only behind Brunei. Now, because of illicit cigarettes, many retailers and people who rely on the sale of tobacco as a livelihood have been hard hit. They understand the harmful effects of illicit cigarettes. Now, the profit margin is high, and therefore unscrupulous elements are very imaginative. You can do it. You can order by telephone, or you can do it by WhatsApp group. You can have various ways to order illicit cigarettes. It's not difficult at all. And primary students may buy a pack of cigarettes, and then they consume it together after school to enjoy their happy hour. The government seems to have turned a blind eye to the situation. It is not tackling the problem. The the C&E department might have stepped up enforcement, but what other means do we have? Can we increase the penalty? Can we enhance the reward for informants? I think these can be considered. Now, I'd like to talk about the enforcement work of the Tobacco Control Office. Now, we have the Smoking and Public Health Ordinance and also the Fixed Penalty Ordinance. Well, they were introduced in 2007 and 2009 respectively. Although the situation has improved with the introduction of these two pieces of ordinance, well, there are many enforcement loopholes. For instance, people are blatantly smoking in bars and restaurants. Proprietors dare not interfere, although they have seen patrons smoking inside their shops for fear of losing the business. And some restaurants will partition part of their shop premises, and they just recede their sitting in area a little bit to allow patrons to smoke just outside their shop. And I think the Tobacco Control Office, according to experience, is very inefficient. Sometimes we could smell smoke in our office, and we knew full well that there was only one person sitting in that office. We smell smoke coming out. Cigarette smoke coming out is useless to report to the TCO. By the time TCO people arrived, now first you won't know when they would arrive, and by the time they arrived, the person would be gone. And according to a colleague, now if you ring up the TCO too often, you'll be asked to find your security guards to deal with that. So we would see posters and about the penalty for smoking indoors. But how useful is that going to be? For non-smokers like us, we are subject to second-hand smoke from someone we don't know. So we are rather helpless victims. If it were a family member, we had to put up with it. But we're talking about a smoker who is not related to you in any way, and we have to suffer from second-hand smoke. Now, for an office worker, he may be in office from 10 to 7 every day, and if he's subject to second-hand smoke for so long every day, this is harmful to his health. Therefore, you should consider accepting circumstantial evidence. If there is only one person inside that room and you can smell smoke, and if you see cigarette butts and you can smell smoke, why can't you accept circumstantial evidence? Or perhaps you can test the cigarette butt as well. Otherwise, you are not really an office to control tobacco. You are just pretending to control tobacco. And if you want to dissuade people from smoking, you should not just rely on increasing tobacco duty, because you are only going to hit the livelihood of people who rely on cigarette selling as a livelihood. So I hope you can target at particular groups, enhance enforcement, enhance penalty, and the TCO should not continue to pretend that they are controlling smoking. Members, we support the bill and we urge the administration to work harder. Thank you.
Mr. Ting-kwong. Thank you, Chairman. Thank you, President. In the latest budget, the FS proposed to increase tobacco duty. All kinds of tobacco products will have the duty increased by 11.7%. So it's about 20 cents per stick. In other words, a pack would cost $4 more. That is from $50 per pack to $54 per pack. I'm a smoker, President, and I understand that smoking is hazardous to one's health, so I support the effort to control smoking. And if I cannot quit, I will try to smoke less. When asked whether there will be further increases of tobacco duty, which would certainly increase the burden of the grassroots and affect the livelihood of those in the retail sector. I have a different view on the effectiveness. I think we should come up with effective measures. The government has put forth some grounds, and that is in relation to the WHO or Article 6 of the WHO Framework Convention on Tobacco Control, which states that price and tax are effective and important means of reducing tobacco consumption. It's thought that when prices of tobacco products increase, fewer people will smoke. And also those who have quit smoking are less likely to start again, and young people are less likely, because of the price, less likely to start smoking. But I have to point out, in 2011, when tobacco duty was increased drastically by 41%, the smoking prevalence dropped from 11.1% in 2011 to 10.7% in 2012, a drop of 0.4 percentage point. On the contrary, among female smokers, there was a slight increase of 1 percentage point to 3.1% in terms of smoking preference. Smoking preference amongst primary 4 to primary 6 students also increased from 0.2% to 0.3% in the same period. From these figures, the drastic increase in the tobacco duty is not is a doubtful means of controlling smoking. According to officials, they are going to look into further measures, effective measures, to control smoking. Earlier on, the Committee on Smoking and Health proposed a 100% increase in tobacco duty to the government. At present, production and marketing of tobacco products is legal. So is it appropriate to take such measures against the sale of tobacco? Is it reasonable to those in the trade? I have raised my queries. Are we going to eliminate the trade as a whole? The Alliance on Newspaper Hawkers have said that the proceeds from selling cigarettes account for 1/3 of their income. Every time the tobacco duty is increased, their livelihood is seriously affected. According to the trade, in Hong Kong, there are 6,000 odd outlets selling cigarettes. There are 400 types of tobacco products and cigars. The total number of people involved in such activities totaled for 35,000 people. 90% are responsible for delivery, sale, and retail of the tobacco products. If we eliminate the trade, there will be what would the implications for these people in the trade and people's livelihood? Has the administration come up with suitable measures to cater for their needs? And I'm also concerned that such proposed increase would prompt more people to buy illicit cigarettes. Illicit cigarettes can be very lucrative. The profit can be up to 20% of the cost. Further tobacco duty increases, they would mean that they get an even bigger profit. And there's therefore a bigger incentive to sell illicit cigarettes. And most of these illicit cigarettes traders have triad backgrounds. And if people buy from them, they will be subsidizing triad societies and provide the financial means for their proliferation. The government has been stressing that illicit cigarette activities are kept under control. Is it true? One is doubtful. According to an international survey, because of the duty paid, tobacco prices in Hong Kong are much higher than those in the Southeast Asia, and it's been projected one package out of every 3 is an illicit product. So the $3.3 billion of revenue is foregone annually. These syndicates would resort to various means to evade enforcement. It's not easy for law enforcement agencies to detect such cases. Mr. President, the Committee on Smoking and Health admits that it would take a long procedure to phase out smoking, and there must be comprehensive measures to help people quit smoking, and that is to say, to help people like me. And there are many smokers who have been smoking for a long time. I myself have been doing this for over 40 years. If the duty is affordable, then people like me may just bear the higher prices. For those who cannot afford the price, they would have to get a cessation service. But the service is not free for those who are smokers for a long time and who have limited means. Has the administration provided sufficient assistance to them? According to the administration, there are NGOs offering free service, but then the the service quota is much smaller than the demand. And when tobacco prices are just as expensive as other drugs, soft drugs, or even more expensive than other drugs, then people who are not keeping to the strict and narrow may choose to consume psychotropic drugs instead. I hope the government would bear this in mind. The DAB would like to stress that in Hong Kong, the number of smokers is at a very low level, and many of the smokers are the grassroots. Increasing tobacco duty would increase their financial burden. If tobacco duties keeps going up, and at the same time the no smoking area is expanded all the time without addressing the other issues. In Hong Kong, we have 645,000 smokers who would not be able to smoke, and they would be suffering from a lot of withdrawal syndromes. What about their needs? They are doing this legally. They shouldn't be targeted. They are on the brink of extinction because you have taken so many measures to target them. It's not worth the while to do this so as to affect social harmony. Although the DAB does not agree to the increasing tobacco duty as the only means to control smoking, but for the sake of public health, we do not object to the passage of this bill. So I submit, Mr. President.
Mr. Riley, Mr. President, Mr. Ting-kwong has already spoken well on behalf of the DAB in relation to this bill. Once again, let me urge the administration to note the following. A packet of cigarettes costs you $50 each. From time to time, the administration will try to increase the tobacco duty rate so as to discourage smoking. But there are still 11% of the population keeping the habit. So perhaps next time we should find another way to discourage smoking. Please think again whether enhancing the tobacco duty rate can really effectively drive down the number of smokers in Hong Kong. Members who smoke aired the same concern. The DAB will agree to the proposed increase contained in the bill. Understand that the WHO is exerting pressure on Hong Kong, and from time to time the KOS is also asking the administration to increase the rate. I think the rate to be increased is already lower than that originally proposed. So probably the government is trying to strike a balance. I must say that members have already spoken the mind of the smokers. I think you need to understand the plight of the grassroots smokers. Please don't give them the impression that the government has only got one option to discourage smoking. Probably you have done a lot more, but they haven't been noticed by the smokers. Smokers just think that they are compelled to buy illicit cigarettes because of the higher and higher tobacco duty rate. In fact, the penetration rate in public housing estates is high. If you want to find more about it, it is not that difficult. So why are you relying on one single tactic only? Have you explained your case directly to the smokers? I didn't sit on that Bills committee, but in a moment I will invite the secretary to elaborate on this point. Now for the increase, I understand that it's based on the WHO's proposal to move it to 70% of the price of the cigarettes. But I think everybody knows about the law of diminishing return. Now, in reality, the tobacco duty isn't that substantial. So can you really effectively decrease the number of smokers? Other than facing pressure from the WHO, can you justify the magnitude of the increase this time? And then for young smokers, in particular, the female smokers, it seems that the figures have shown a decrease in the number of female smokers, young female smokers. But as Mr. Wang Ting-kwong has said, at the district level, I see that it's quite common to have young women smoking. So have you really assessed the effectiveness of the increase of the tobacco duty rate? Can you really try to help the young female smokers to quit? I think it's something of concern to me. Now, many young people have told us that ketamine is being sold at a low price. So if you further increase the rate of tobacco duty, maybe young people will be driven to take ketamine instead of cigarettes. Please don't just take on board the views of the WHO or KOSH without thinking or finding other solutions to the problem. I think the government has already listened to the views of different stakeholders. Therefore, I will support the bill. I hope the government would keep up with the good work. In particular, please tell the stakeholders as well as the community about the effectiveness of your policy. Does any other member wish to speak?
If not, I now call upon the Secretary for Food and Health to reply. Secretary for Food and Health, President, the Dutiable Commodities Amendment Bill 2014 aims at implementing the recommendations in the 2014-15 budget and to increase tobacco duty by 20 cents per stick, or an increase of 11.72%, and also to increase the duty of other tobacco products at the same rate. This is to protect public health. As for the justifications, the provision of cessation services, the tobacco increase, implication on illicit cigarette activities and on newspaper hawkers, we have already responded to the views expressed by members in the Bills Committee on the bill. Most members expressed support to the proposed tobacco duty increase. To protect public health, our policy has been to encourage people not to smoke and to control the smoking habit. We have adopted a multi-pronged approach, including publicity, legislation, education, enforcement, so as to reduce smoking and to prevent youngsters from becoming addicted to smoking. Through years of publicity and enforcement, the number of smokers has been on the decrease. The prevalence rate has dropped from 23% in the 80s to about 10.7% now. But still, annually, we have 7,000 people who die of chronic diseases because of smoking or because of second-hand smoking. According to a local study, the economic cost through smoking and second-hand smoking is $5.3 billion. And according to the Association on the Prevention of Cancer, among the rich countries, 1/3 of male cancer patients or 1/8 of female cancer patients are the result of smoking. To improve public health and to reduce the pressure on the healthcare system, we must encourage people to quit smoking or to stay away from smoking so as to reduce the harmful effect. According to the Framework Convention on Tobacco Control, Article 6, tax and price is effective important means of reducing tobacco consumption. WHO considered that when prices of tobacco products increase, fewer people use tobacco. Those who continue to smoke consume less. Those who have quit smoking are less likely to start again, and the young are less likely to start smoking. In this regard, WHO encourages its members to raise taxes on tobacco products periodically and recommends raising tobacco taxes to account for at least 70% of retail prices. Other international organizations have also put forth statistics in this regard. According to a study conducted by World Bank, on average, if the price of cigarette increased by 10%, then in high-income countries, the demand on cigarette would reduce by 4%. In low-income and middle-income countries, the decrease would be much higher at 8%. According to U.S. Centers on Disease Control and Prevention, CDC, increasing the unit price of cigarette is an effective means to reduce the use of tobacco and tobacco products. If the price goes up by 20%, then the preference rate of young smokers will reduce by 8.6%. In 2011, tobacco duty was increased by 41.46% or 50 cents per stick. Those who habitually smoke on a daily basis reduced from 11.1% in 2010 to 10.7% in 2012. And the number of sticks consumed also reduced from 13.4% in 2010 to 13% in 2012. For those who habitually smoke daily, 1/3 of them indicate that after the tobacco duty increase in 2011, they have purchased less cigarettes. About 1/5 of those who have quit the habit because of the prices of smoking of cigarette products. So this goes to show that increasing tobacco duty can help people quit smoking, and is positive in promoting public health and control smoking. Most smokers started to smoke while they are in their adolescence, so to prevent youngsters from getting addicted is important in reducing the smoking population, and increasing duties and important measures. Apart from increasing tobacco duty, we also offer an important service, that is cessation services. Some members are concerned whether there are sufficient services offered by the HA. Apart from the cessation clinics offered by the HA, the D of H also increased its resources by threefold, from the $35.8 million in 2008-09 to $126 million in 2012-13, mainly in the use in the subvention of NGOs in launching community-based preventive and cessation services. Those people who have patronized the cessation clinics also increased from 4,100 in 2009 to the 23,000 in 2013. In recent years, the government also actively cooperates with NGOs to provide various cessation services in various formats, such as Chinese medicine, acupuncture, mobile clinics, outreaching smoking, cessation service to workplace, helping the ethnic minorities and new immigrants to quit smoking, etc. And the number of service users have increased drastically. The course has also been supported by regional partners, and they have launched the 8 Quit to Win smoke-free community campaign in all the districts. We'll continue to invest in terms of resources in cooperating with NGO in providing smoking cessation service through public organizations and NGOs. We offer a full range of cessation services, including counseling, advisory, and also the promotion efforts. Some members are concerned that there's a rising trend of female and juvenile smokers. Koch and D of H has been launching publicity and education programs targeting female smokers. For example, in 2010, there was a theme on gender and tobacco, in order to show a concern of the promotional efforts to sell cigarette to female, and an API was produced called Smoke-Free Women to bring out the message that smoking can have a bad influence on women and those close to them. We encourage female smokers to quit smoking, and encourage young women to refuse the first cigarette. We continue to invest in publicity and education programs. In the recent thematic survey, the findings have caused the concern of the Bills Committee. We continue to cooperate with Koch and to promote a smoke-free life to women. To enhance our service to young smokers, the D of H cooperated with the Hong Kong University School of Nursing in offering cessation hotline to those under 25, and we also have other activities going to all the districts and primary and secondary schools and kindergartens. We have interactive education drama performances. We disseminate knowledge on smoking hazards, and also We have the smoke-free youth ambassador leadership training programs targeting those in the age group of 14 to 18, so as to promote smoke-free lifestyle. The DOH has also cooperated to launch a smoking prevention program in kindergartens. Enforcement is an important part on tobacco control. Some members are concerned about the enforcement against smoking in statutory no smoking areas. The Tobacco Control Office received 18,000 complaints in 2013. During the same time, 27,000 inspections were made and 8,000 fixed penalty notices were issued. And in addition, law enforcement officers of the TCO would inspect targeted black spots, and if necessary, will also involve the police and the FHD. And in the course of inspections, the officers will encourage restaurant goers and other citizens to report on illegal smoking activities in restaurants. Some members have expressed concern of illicit cigarettes. This is a problem all over the world. We have taken stringent action to tackle illegal activities such as illicit cigarettes peddling. The C&E department has taken robust action against illicit cigarette activities, making use of a road cargo system. They are trying to tackle the activities at source. In 2013, the C&E department detected 25 major cases and confiscated 39.3 million cigarettes, which accounts for nearly half of the 89 million cigarettes seized in 2013 as a whole. The C&E department has been able to stop inflow at sources, and also illicit cigarette peddling activities related complaints have reduced by 10% and 40%. And after the announcement of the tobacco duty in the first quarter, the number of cases detected is more or less the same as the same period in 2013, and illicit cigarettes has dropped by 10%. The C&E department has paid attention to telephone ordering of illicit cigarettes. Two task forces have been set up to target such activities. In 2013, there were 131 and 195 cases respectively involved in telephone ordering of illicit cigarettes. In the first quarter of 2013, such activities has reduced and complaints have reduced by 70%. We'll continue to pay attention to the implications of the tobacco duty on newspaper hawkers. We will keep close liaison with these hawkers and try to improve their business environment. In 2009, newspaper hawkers were allowed to sell more of the products in their stores, and in mid-2013 we allowed newspaper hawkers to set up Wi-Fi hotlines and electronic display panels in their stores. We continue to listen to their concerns and work on improving their business environment. The FHD would offer suitable assistance. In the past 30 years, we have been working on smoking control, and we have achieved some good results. We need to increase tobacco duty and continue with a progressive and multi-pronged approach to protect public health. With regard to questions raised by members, as I've said, I hope what I've said can clarify those queries. As regards whether the government is just adopting one measure to tackle smoking, there are other measures in education and publicity, and also the enforcement against illicit cigarette activities, and we also consider other constructive views expressed by members. I can promise members that in the future we are not ever going to rely just on tobacco duty increase to control smoking. Some other members, like Mr. Wong, if you have to get the smoking cessation service, the service organization will certainly do their best to offer the service. I urge members to support the second reading of the bill. Thank you. And I'll put a question to you, and that is the Dutiable Commodities Amendment Bill 2014 be read the second time. Would those in favor please raise their hands? Those against, please raise their hands. Mr. Gary Fan claims a division. The division bell will be rung for 5 minutes.
開始表決。
Voting begins.
請各位核對表決。
Please verify your votes. If there's no question, voting is closed, and the results display. The result is 35 present, 31 for, 2 against, 1 abstained. The question is agreed by a majority of members present. I declare the motion passed. Dutiable Commodities Amendment Bill 2014, committee stage. Council is now in committee, and I propose the question to you, and that is that the following clauses stand part of the Dutiable Commodities Amendment Bill 2014. Clauses 1, 2, and 3. Does any member wish to speak? And I'll put a question to you, and that is that clauses 1, 2, and 3 stand part of the bill. Will those in favor please raise their hands? Those against, please raise their hands. I think the question is agreed by a majority of members present. I declare the motion passed. Council now resumes. Third reading, Dutiable Commodities Amendment Bill 2014. Secretary for Food and Health. Chairman, the Dutiable Commodities Amendment Bill 2014 has passed through the committee stage. Here I would like to thank Dr. Joseph Lee, Chairman of the Bills Committee, and the Bills Committee members for their understanding and support during the scrutiny. I move that this bill be read the third time and do pass. I now propose the question to you, and that is that the Dutiable Commodities Amendment Bill 2014 be read the third time and do pass. Does any member wish to speak? I now put the question to you as stated. Will those in favor please raise their hands? Those against, please raise their hands. I think the question is agreed by a majority of the members present. I declare the motion passed. Dutiable Commodities Amendment Bill 2014.
Members' motion on subsidiary legislation.